Hello, Mrs. Lloyd. Hi,
Good
my
morning.
name is Dr. Tile. Pleased to meet you.
And you?
You've come to see me because of your hands. Do you want to tell me about it?
They get very cold and they go white if I'm driving, and then they get really quite painful
Right.
when they're warming up. And it makes some tasks difficult. So if they're cold, then it's struggling to open the front door and things like that.
Okay.
And because I'm a community therapist, people are always complaining that if I touch them, they're really cold.
Cold, yes, yes. Okay. And how long have you had them, these symptoms for?
About a year.
Okay.
I also get cold feet as well and cold toes.
Cold feet as well, okay. So when did you first notice these symptoms?
I think when I was driving mainly,
Hmm.
and I'd be driving along and my hands would go numb
Yeah.
and my fingers would go white.
Okay. So they'll go numb and white. Do they change any other color?
Yeah, they sort of go purpley and then they go red.
Okay. And what brings these changes on? Is there anything specific which brings them on?
If the weather's colder
Cold
at
weather.
all,
Okay.
but cold that isn't cold to other people. You know, it can still be in the summer, and if
Yeah.
I'm going walking, they'll go white.
Okay. Apart from this color changes, and do you get pain in your joints?
I do, yes.
Where about?
In my fingers and my thumbs
Okay.
and my wrist.
So finger, thumb, and wrists. Do you get stiffness in these joints?
Yeah.
How long does it last?
How long's the stiffness last?
Yeah.
Depends what I'm doing. If I'm washing up or anything like that, it actually makes it worse.
Yeah.
Yeah. It does vary.
Okay. Right. Do you have any ulcers in your fingers? Do they sometimes break down the skin?
I haven't got any at the moment, but sometimes I get like red marks on them that are sore and itchy.
Right. Okay. But have you had any ulcers where the skin breaks down?
No, not on my fingers.
Okay. Do you have any swallowing difficulties?
No.
No. Or any breathing troubles?
I've got asthma.
You have asthma. Okay. Any medical problems apart from asthma?
No, I had thyroid problems some years ago, but that's okay now.
Thyroid is okay. Okay. Do you smoke?
No.
Alcohol?
A little bit. Social.
Social. Okay. Do you have any treatment for this?
I try and keep them warm, but
Yeah.
you look a bit silly in the summer if you're walking around with gloves on, but that seems to be the thing that helps the
So
most.
gloves
is keeping them
helps
warm.
with the Okay.
Mm.
Any family history of similar complaints?
My mother's got arthritis,
Yeah.
and her circulation's not good.
Okay.
And my daughter's got poor circulation as well.
Poor
Well, her
circulation,
hands
yeah.
go
Okay.
like mine.
Okay, so let's have a look at your nails. Is that sore when I press?
A little bit.
Have you noticed any skin changes? Have you noticed it's becoming more tight or shiny?
No,
No,
dry, if anything.
just a bit dry. Okay, just have a look at your mouth. Just open your mouth. Okay, that's fine. Now quickly listen to your heart and lungs. Just can you lift this up for me? Deep breaths in and out. Okay. Right. So how did you say it was affecting you? You said you had problems driving because your hands are cold.
Yeah, driving, and if I'm trying to open the front door with the door key.
Yeah.
And because I say I'm a community therapist, if I need to put my hands on people to treat them, they complain because they're so cold.
Yeah. I mean, listening to what you've said and just examining your joints, I think what you have is Raynauds. This is a
Right.
condition where there is, as you said, explained, poor circulation, and the small arteries of your hands are very sensitive to changes in temperature. So when you go out in cold or in cold weather, they sort of constrict, and the blood supply obviously decreases, and that causes all these temperature changes and color changes. And obviously, you need to keep your hands warm, and that's a common thing to do, to wear gloves. And what you're also describing are chilblains, when you get these spots and the skin breaks down.
Right.
Now, it could be either primary Raynauds, where that's the only thing and it's not associated with any other condition. But sometimes it is associated with other conditions, and we need to just investigate in your case. Although I think it's primary Raynauds. So we'll do some blood tests today. We'll also do a heart tracing, possibly a heart scan and some lung function test to make sure it's not affecting any of the parts of your body.
Okay.
Okay, you have 2 minutes remaining.
Okay, and if you apply creams, just to keep your hands moist, and gloves. But if you think it's too much of a problem, we can also give you certain medications to help with the circulation.
Do you think it will get any worse or stay as it is?
It depends. If it's a primary Raynauds, it's usually more of a nuisance rather than anything serious. And I hope that's the case. And looks like, because I haven't found anything else. So if that's the case, then it usually stays the same. It's more of a problem in winters. And we can give you some medications, as I said, to relieve the symptoms.
Right.
But sometimes you can have more problems. You can have ulcerations. And in that case, we have certain other medications that we can give you. But hopefully, it will not go to that stage.
Okay.
Okay.
Right.
Anything? Any other?
No. So I need to be careful not to get them too cold. Then
Yeah.
To avoid the ulcers.
Yeah. Okay.
What is your diagnosis for this patient?
My diagnosis for this patient is most likely a primary Raynauds disease. This is evident by cold hands, triphasic color changes on history, but there is no associated ulcerations or history of ulceration in the fingers. There is no sclerodactyly, and there is no pulmonary fibrosis or increased second heart sound indicating pulmonary arterial hypertension.
And what are the secondary causes of Raynauds syndrome?
The secondary causes are, most common is systemic sclerosis. It can also be present in other connective tissue diseases like systemic lupus erythematosus, rheumatoid arthritis, Sjogren's syndrome, polymyositis. Sometimes it can be present in people who work with vibrating tools like pneumatic drills. Other rare causes include cervical rib, cold agglutinin disease, and these are the main causes. Raynauds syndrome is also commonly encountered station in paces. The diagnosis should be quickly apparent on initial inspection of the hands, and the history should include talking about triphasic color changes, precipitating factors, and looking for secondary causes, most likely which is systemic sclerosis or scleroderma. The question should be directed against complications like dysphagia, breathlessness, swelling of the feet indicating pulmonary arterial hypertension. Examination of the hands should include looking at pulp atrophy, asking about ulceration of the fingers, checking for sclerodactyly by pinching the skin of the dorsum of the hands, and also looking at the face for telangiectasias and asking the patient to open the mouth.